So my name is Mohammad. I'm the founder and CEO of Patients Know Best, which is a patient-controlled medical records company. So we take the medical record and we put it in the hands of the patient, then the patient invites everybody else on their team. It's great for the patient because they're finally in control of their care, but also the healthcare system saves money and clinical care becomes much more safe and effective. That's the basic idea behind the company, and I did it just myself. Basically, I'm a patient with a long-term condition, and I just wanted to solve the problem for myself. But then it turns out there's tens of millions of people like me in the world who all had the same problem, and then as well as millions of healthcare professionals who were frustrated with unsafe, ineffective care. And when they use the system, it just helps everyone involved in the healthcare system. Sure. So I think it's the patient control that's innovative about what we do. I was just thinking of a parallel the other day. I was reading about the history of Braille, how it was invented. So Braille started off with a college in France where they had taught they'd bring all blind people from the country and they would teach them how to read books where the letters were raised, which was a transformation because before blind people couldn't read. But it was also very expensive, and the blind could not write, they could only read. And so these children would be brought in from all over the country, would have to write letters home, and they could only do so by dictating to their teacher. And what the teachers couldn't understand is, why would a blind person want to write? I can write for them at any time. But Braille, one of the students there, basically had heard about people in the military who need to read in the dark so they don't get shot when they light up, would put holes in paper, and that would be. And so he thought of an alphabet for blind people. And he taught himself and then taught his fellow students. And the teachers of the university really reacted against that. Why would blind people want to write without the sighted helping them? And so they burned all the Braille books, they banned them all, they banned the teaching of Braille, until at a certain point they kind of switched and then began embracing it. But it's the same idea of, why would a patient want to control the record? Why would they want to write in their record? Surely a professional could do the writing for them. But in the same way that blind people transformed from people who the state had to spend money on as an act of charity to people who could have jobs, who could pay taxes themselves. It's that same independence they get with patients. When you give them the control of their record, they switch from a burden on the state to people who help themselves and really improve the health of the whole country. My biggest problem is patients. So what we're doing, we managed to do it far faster than people ever thought possible. And it's basically because so many people like what we do, they all pitch in, they all help us out. They're people who, from the early days, I can understand why they're just they put in a good word, they insisted something out, they put in their budget. People just pitched in. It meant we went really fast, really quickly. But I'm still impatient, and we still think that we can do much more quickly, and that's kind of what keeps us going through every day. I listened to a lecture last month by a professor on innovation, and he was saying most people think that the world needs more innovation. This is not true. There's lots of innovation. The problem is it doesn't diffuse, it doesn't scale up as you're describing. People think and if you look at diffusion in healthcare, if you look at the time at which different drugs were adopted, the single difference that explains the speeds of adoption, and the speeds are so slow sometimes, it's really disappointing, is, was there a patient charity involved in pushing this innovation? So if you look at HIV/AIDS, the AIDS charities were really important in pushing retroviral therapy across the USA and across the world, just adopting it very rapidly, whereas other drugs which didn't have charity backing just went through very slowly through the medical profession. And so one thing we'd done early on is we started a campaign called My Health, My Records. And we've just been doing it kind of in stealth, just approaching individual charities, which are putting their name on it. Basically says, for my health, I need a copy of my records. And then I tell them all their patients about it. So Thalidomide Trust, European Federation of Neurology Associations, Rare Disease UK, Genetic Alliance UK, Cure Parkinson's, all these charities have put their name to it. And they're basically busy telling all their patients, go and demand your record. And that is kind of the next stage, is we're kind of getting to really large charities, putting out that message. That's what drives the adoption across large geographies, rather than just a few innovative clinicians who kind of want to do something right. It's going to really scale it up. I like food a lot. The books that I write They're officially under a technology rubric, but they're actually, I call them Trojan mice. So they tend to, the person who reads them thinking they're getting a manual, but by the end they become a change agent. You've taught them that really cheap technology can make them transform their workplace. And they're written in lay language. So a lot of the first book I wrote was Handheld Computers for Doctors. I had lots of patients and non-healthcare professionals read it, one of whom was a chef in Baltimore. So she got in touch with me saying, I really like handheld computers for doctors. Can we do one for chefs? I said, sure. And we basically transfer the domain expertise. So the examples will be culinary rather than medical. But for me, it was really interesting. I hadn't realized before, but chefs are really like doctors, or like surgeons in particular. The chef is responsible for the whole restaurant, all the employees, in the same way that the surgeon is responsible for all the theatre staff. And they have to be quite dictatorial sometimes. They get short-tempered because the whole responsibility is on them. And actually, most of their work isn't the cooking or the cutting, it's the information management. Do we have the ingredients? Do we have the suppliers? Do we have everything at the right temperature and so on? And that's where a handheld computer becomes really powerful. Really cheap technology in the hands of the person doing the work just transforms the work that's being done.